President Biden made a lot of news recently when he declared that the pandemic is over. Let's talk about it. Hey, everybody, it's Dr. David here. And I know this brought a lot of attention to people. Um, People who thought that maybe that there was too strong of a statement, too early of a statement. Other people saying, yes, finally, people are acknowledging this. So I wanted to talk a little bit about this. I know this probably brought up some pretty strong emotions, almost where no matter where a person lies on their whole belief system regarding the pandemic. But in a 60-minute interview on Sunday, which was September 18th, President Biden said the following. The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it, but the pandemic is over. Now, I realize that this is not an official proclamation. He is not a king or a dictator that he can just wave a wand and say, okay, that's over and everything goes back to normal, or he's not a genie that can just poof us and make that happen. But I still am really glad that we have our highest ranking official fully acknowledging that we are past the pandemic panic part of this whole disease. Now, by pure definition, actually the pandemic is not over simply because of the definition of the word, because pandemic means that the infection is everywhere throughout the world. And that is still true, but of course how we are all handling it and what we have at our disposal in terms of helping us out is very, very different. Now, of course, we have always talked about like when will we move into the living with COVID phase, which is where we're at now. Previously, we were in a hiding from COVID phase, whether it was hiding in our homes, whether it was hiding behind masks. I realize that some people were much more in favor of that than other, but nonetheless, we have moved into this. We are now firmly in the living with COVID phase, just like we live with influenza and we live with RSV in our children every season, etc. So this is just now kind of a fact of life, and it's something that we're going to be with for a long time. But of course, once Omicron came about, I think we almost all realized we're not going to be able to avoid this. So then the question became, what can we do to protect ourselves, right? And that's a good thing because we have ways of protecting ourselves. So now, of course, another great thing is that businesses and schools are now pretty much back to normal. Okay. I realize that there are some places that have vaccine mandates. Yeah, as you know, I've not been one who have believed in forcing vaccines on everybody, that if someone believes that it is in their best interest or their family's best interest, that they should have a choice. They should have the option to be able to take something if they think is in their best interest. And still to this day, I do believe that, especially in high risk populations, and especially when antibody levels may be fading, that there can be benefit for some people with the vaccine, especially with the new BA4, BA5. We know that the vaccine at the beginning of the pandemic was very effective in terms of stopping hospitalization and death. We know that it had done pretty good with stopping the disease from spreading in the first place. We know that that did not happen, and of course, time will tell what happens with the new booster out there. But understanding the pure science of it, if you're making an antibody directed against the variant spike protein that we're having now, one should be less likely to get sick from that. We'll know now in a couple months. Okay. Now, what else does this mean? Kids are able to resume their lives, their social lives, their sporting events. They're able to participate in drama and other types of theater indoors, able to do things indoors overall. That's a great thing. And we, of course, not needing masks, which we know overall probably was pretty detrimental from the development, especially of a lot of toddlers, because of the importance to be able to see someone's face and their eye contact as well as what their mouth is doing in order to properly communicate. Now, of course, we also have effective treatments. We know that there are pharmaceuticals that are now available that are helping, especially the high risk populations. We know that there are natural protocols, such as what we've put forth with our protocol, that seems to have been wildly effective, especially considering the wonderful outcomes that we've seen in our practice compared to what we're hearing out in the real world and what I'm hearing from colleagues who are not taking the more functional medicine, the more holistic approach. But at the same time, hopefully with this acknowledgement again, I'm hoping that we are now able to get past the vaccine mandates. We're hearing more and more, like in New York City, that private businesses are no longer going to be required to have this. Still some issues with city workers up there. Hopefully that will change too. I think over time it will. Now, as you may expect, more than anything, I am glad that we are now in a your health, your choice phase. Okay. And we're hearing that kind of from everybody now, from all sorts, people who've been demanding their choice. But if you hear it, whether it's the government, the CDC, FDA, everybody is now more talking about, okay, this is a choice that you can make. And people obviously recommend this or they recommend that, but it's clearly being put in the individual's hands. Let's face it, probably where it should have been from the very beginning. Now, as I said, some people will choose to take vaccines, and I'm glad that they have the choice to do so if they're comfortable and that's what they feel is in their best interest. Great. People who catch the virus can choose to take medications. They can choose to take supplements. They can choose to just ride it out. And of course, people now can forgo wearing masks pretty much completely, maybe not in some medical facilities in some particular circumstances, but now it seems as if most of us have the ability to choose if we want to wear a mask, what type of mask we want to wear, and where we're going to make it. So, as with everything, as we've said since the day one of starting these videos, do your research, weigh the pros and cons, make a list of the benefits versus the risks. Of course, speak with your healthcare provider, especially if you have unique circumstances where you'll need a little bit more guidance, and get information from reliable sources. And hopefully, you find us one of them. So, thank you very much for listening. Again, if you haven't checked out or signed up for this YouTube channel and subscribe, please do so. Please join us on our Patreon, become a member there. Hit us up on our other social media platforms and share the love with everybody that you know. Have a great day.